Hey everyone, thanks for attending our virtual presentation. I am Shrenik. I'm the founder and CEO of Marigold Health. I'm here with Julie. She's our lead peer in Delaware. We at Marigold are a virtual provider of peer support. We were founded out of Johns Hopkins in 2016 with the mission of giving people more agency in their own recovery. I'm excited to be able to have this time to hopefully make everyone a bit more aware in terms of the power of peer support and really the outcomes that peers can drive, as well as a sort of exciting opportunity we have now to use technology to make peer support much more accessible. And before we dive into things, of course, I'm going to hand it over to Julie, our lead peer, and give her a chance to introduce herself and talk a bit about what got her into peer support.
Hi, I'm Julie. I'm a peer support specialist. I've been a peer support specialist for going on about 4 years now, for maybe almost five. I began working at a detox facility where it was primarily focused on the medical aspect of peer support, more like Suboxone and treatment and that sort. And I would do like the intakes and that process for everyone. And then I moved on to being recruited to work for mental health court, where I was a peer to those in the justice system. And I worked for Mental Health Associations of Delaware, which was a really neat environment to work at based on like what I do. And now I work for Marigold Health as their lead peer in Delaware.
Yeah, that was a really quick overview. Packed a lot of experience, right, into those 4 years, and it's one of the reasons why we enjoy working with peers so much. It's because, right, in many cases, peers get to see all aspects of the system, right, from criminal justice to housing to medical to social. And now, Julie, for backing up a bit, for the folks that are maybe a little bit newer to the space in the audience, how would you explain peer support? Maybe how would you differentiate it or help someone understand? Okay, I'm getting peer support. What does that mean you're actually getting?
So a peer support specialist, as if you have heard of a peer, it's someone with lived experience. But what does that mean? That means it's someone who has experienced similar things that you've experienced. So it would be going to a trained therapist or a psychologist and them kind of understanding based on their education where you've been. But a peer support specialist, someone who's also educated but can understand from a firsthand where you've been. So I find people are more comfortable speaking with a peer, feeling like that connection between the two, that they truly understand where they've been and how they feel, as opposed to just like learning about it, which sometimes doesn't allow people to connect the same way that a peer could connect with someone.
Yeah, I think that makes sense. I mean, it I guess makes you think that like from a certain context, right? Even the most well-educated doctor is ultimately telling you something you should do. Whereas a peer, even if they're not telling you what to do, they are saying, "Hey, this is what worked for me," or "This is what my experience is." So it's a little bit greater degree of commitment. Have you found that there are many patients who are willing to engage with a peer who might not be willing to engage with a therapist or a doctor?
Absolutely. I've even been met with some apprehension from my clients that I've worked with until I shared my story. Talking about mental health and substance use is very touchy. It's not something that you want to open up to with everyone or many people. But I feel like when someone can say, "Hey, I've been through it," you feel less judgment. You feel more open to maybe sharing what you've been through. And I think that it's opening that door for people who may not want to share this with just anyone to have someone that they do feel comfortable sharing it with. And it is important to talk about things and kind of get it out and get help. And so you want to get help from someone that you feel you can connect with, that's not going to judge you, that you have things in common with. And it's been proven that peer support, it works. So
And what got you like personally sort of committed to becoming a peer?
for that reason, for meeting with many people, educated people, there's nothing wrong with a therapist or a psychologist. I feel, sometimes it's important to see both. But I think that in my journey, having people help me who have actually been through it really changed my perspective.
Hmm.
It allowed me to feel those things connected and not judged. And it was like someone who actually had been through it, and I felt they had better advice to help me get through it. And I found that when I shared what I went through, I saw it help other people, and I liked that. And so I wanted to continue to do that.
Yeah. That makes sense. And I think it's interesting, right, to think about the idea that for many people, especially because we're doing a lot of work in substance use now, right, 12 steps or AA are places they're going to go first before they necessarily, right, even go to a
Mhm.
clinician. And peer support really, right, is practiced regardless of if there's a certification or not, right, is practiced everywhere. Um, Now, I'm curious, sort of, what were you so in your role as a peer before Marigold, what were you sort of thinking about in terms of how your sort of career or career role as a peer would evolve? How are you thinking about that then, and how, if at all, has that really been changed? Now that you've started working with us.
Well, I'm grateful that in Delaware, peers are very well supported in our community, and they're very well known, and we have a lot of opportunities here. So we have I took a class called Peer Integration, and that's where I learned that peers have a place everywhere in doctors' offices, for in the medical side and the legal, side. And so you really can grow as a peer and not just feel like an entry level worker. You can actually grow and learn and educate yourself. And like I said, peers are educated. We have to get certified. There's things we have to know and learn. It's not just, oh, we went through it. Let me then help someone else go through it. There's a lot of education that goes into it. And so you can always grow your education, your foundation, and continue to, open new doors and things like that. So it's pretty neat.
Yeah, and I think people oftentimes don't realize the true degree to which peers really oftentimes go through this type of training and get education in these different settings. What were some trainings that you received that you didn't really imagine initially would be sort of important tools in your work, but ultimately ended up being quite impactful in reaching patients?
I will say at first, when I knew there had to be a certification, I mean, obviously, I know that not just anyone can go and help people, that there's, certain things you have to know when you're dealing with people's mental health and stability and things like that. But there's a language to peer support that not a lot of people are aware of. You have to be very sensitive to triggers, to things like that. And so it is very important to be an educated peer. I mean, it's beautiful to want to help people, but you have to know the appropriate way to help people and to know that people are very sensitive and vulnerable. And you have to be educated to know where your place is and what you can and can't do. So it's very important for peers to educate themselves. And maybe not a lot of people know that we have education, but we do. It is very important that we are educated in what we do.
Definitely. And in fact, the education is, to your point, it's definitely two ways. So when you actually, approached us, right, and we started talking throughout our interview process, and now that you've been here for some time, what were some questions you had for me, after you saw like our job posting? Because, right, it's just as important as sort of how we communicate, right, to the peer community, as vice versa.
Actually, I was very curious how a tech company and peers would emerge and work together. And so I was really pleasantly surprised to learn that everyone on the team had some kind of life experience or some kind of something that made them passionate, which I think is very important. If you're going to do this work, you have to have purpose and passion and really be invested in what you're doing. And the digital, I think that's just where we're going in the world, not just COVID related, but digital and virtual support has come a long way. We do telehealth and we meet people, virtually and stuff, and it allows one more time to meet with more people. You don't have to drive somewhere, so it makes it more convenient. And so it may push someone to, okay, I don't have to do this, that, and that. I just hop on my phone or my computer and I can get the support that I need. And it may push someone to actually, get the support. By being more convenient and more easily accessible and things like that. So I thought that was really neat on how we reach people in this company at Marigold. And I'm just really eager to reach out to people and just see how big this could be and like, the impact that we can make digitally and virtually.
Yeah, and it's definitely one, it's been great to have you, but it's like even I think about my background as I spent some time as a caseworker in Baltimore, and it's just we spent so much time, so little time, I guess, comparatively speaking, doing the actual mentoring, doing the actual support, and so much more time spent on the like, how am I going to find this person? When am I going to see this person next? Am I going to see this person next? And I think everyone in the human services world generally, providing some type of SUD or BH care in the community, experiences that issue. How does, I guess, sort of the outreach you've been trying here compare to some of the work you've done to get in touch with folks, say on the mental health core or in the detox setting? Like, help us understand, I guess, like what does the day to day for a peer in those settings look like?
So when you work in an environment, let's say detox, for example, or even the legal system that I worked at, so the people kind of come to you And therefore, I mean, as we know, we have a pandemic of an epidemic with substance use and everything. So there's an endless supply of people who need services and everything. So they're coming to you. And what I found at Detox was it was a revolving door. We would see the same people and the same people. And so it didn't feel like anyone was really getting the help that they needed or the support that they needed. And so I thought if I worked at mental health, which is, I feel, the underlying, issue to a lot of this, that maybe then I can make or see the difference that I wanted to see. So I worked for the courts, and again, people were brought in and kind of mandated. And what I love about this company is nobody's mandated to see us. We don't require you to see us any, like this many times a month. You're not mandated for anything. This is 100% like geared towards the individual and supporting them, how they want to be supported, when they need to be supported, when they want to talk to us, and they can reach out to us through text, which is cool because that's convenient. And the other places, you kind of lose your peer when you move on or you graduate from the program. And so we guide you through your entire journey, which is important because when you trust someone and you begin receiving support from someone, you want to keep that person. You don't want to tell your story all over again. You don't maybe want to meet with someone new and start all over. So we get to guide them through the whole process, which is very unique. It's never been done in Delaware before. I'm not sure about other places, but it's definitely new here. And so that's really exciting that they get to keep us, and we're 100% geared towards them. Supporting them is our main mission. So it's really neat.
Yeah, I think that's very well said. And I think it's just like the way you describe it, right? It talks about like how we're sort of putting peer support in all these different places where people, it's basically are forced to admit that they need
Mhm.
help, right? When they come into a detox and they're leaving the court system. And it's like it's very backwards, right? In a sense where it's like you think the peer support would be what comes first. And then, right, only afterwards, right, you'd be like, okay, hey, like maybe we need additional support here or there because the peers are all around you all the time. But and that's the world, right, we're ultimately trying to work to. So
Yeah.
so yeah, I mean, I'm also curious. And now that you're here, a big thing that's new about what we're doing here is we do a lot over text and we do a lot over groups. So I'd love to touch on both of those things, but like starting with text, what's been your experience with clients over text before, and like has working here, or let's start there. Like, tell me about like what's it been like with text versus phone before? Are people only willing to talk on the phone? Like, what have you really seen prior to Marigold?
Yeah, there are some people that only like to text. They don't really like to talk on the phone. Sometimes the younger generation, so it's really nice to be able to reach the younger generation through text. That
Hmm.
seems to be how they communicate. And there's some people that like to talk on the phone, or people who are really busy. I know, especially early in recovery, there's a lot going on. You're trying to rebuild, and maybe you don't have the time to go physically meet with someone. You don't have the time to talk on the phone, but you can send a text while you're doing something else. Texting allows us to free up some of our time and sometimes multitask and whatnot. So having both calling and texting as a way to communicate really opens up doors on just convenience for everyone involved, for the peer to be able to reach out to more than one person at a time, and also for the person receiving services to be able to make it on their time, on their schedule, how they want to communicate. So it works out both ways really well.
Yeah, that's it's interesting because like you mentioned convenience, which is definitely there, but it's almost like digging in. It feels like there's a little bit more that relates to right kind of like that peer principle of mutuality because like I have a psychiatrist, right, and like I text my psychiatrist sometimes where I'm like, why haven't I gotten my text from CVS that my prescription's been refilled yet? But like I really don't know what, like, if my psychiatrist said text me 24/7, like frankly I'm not sure like what I would actually tell her beyond her telling me to pay her and me telling her to fill my prescription. What makes it different with a peer, right? Like help people understand, I guess, like what are those interactions like then if they're not an hour on the phone with someone.
I mean, I think everyone has experience. If something happens and maybe you want to vent, something happens throughout the day and you just want to tell someone about it. Sometimes we have people who don't have a big family or a lot of support or a lot of friends or just starting off and just need someone to talk to. Maybe they need an unbiased person. Maybe they don't want to tell people in their inner circle what's going on or what they're feeling, but they want to tell you because they trust you as, their peer and whatnot. So like, let's say something happens, you could just pick up your phone in that moment and say, oh, such and such happened, and you could just get it off your chest. You don't have to wait until you go to the therapist. I also see a therapist. I see her once a week because a lot happens in my life, and I don't think once a month would be enough. So for me, sometimes I do text my therapist, oh, such and such happened, and I just need someone to help me work through it in that moment, and then I'm okay. But to have it all built up for your therapist once a month or whatever, maybe too much for some people. So the fact they can pick up their phone and just send me a text or pick up their phone and call me, and it's 5 minute phone call, like, this happened today, or I thought about, using, or I had a bad moment, and we can just deal with it in the moment. So that's what good about peers and digital and virtual. It's in the moment, that you can work through almost anything with your peer.
Yeah, and it's like this meshing of like, yeah, the technology makes it accessible, but at a fundamental level, the reason it works is because you can always basically find a natural reason to engage with the peers, what I'm hearing you say,
Hmm.
right? Like if I want to engage with the therapist, I have to be like, all right, like, it's time to sit down and get some therapy. If it's the middle of the workday, even if I might have the ability, maybe my job lets me take time off, or I just might not necessarily even want to, right? Like, this is not the
Hmm.
time for an hour of therapy, but it's different because it's like, someone you can almost always justify, right, or find a reason to engage them. So that makes a lot of sense. Now on the group side, I'd like to shift gears to talk about that a bit because everyone I think in their head has thought of like 12 steps, AA, right? These are embedded in culture, popular imagination. But then when we look at like the Medicaid space, right, where we do most of our work, most of the peer support that's being provided is one-to-one. Why do you think
Hmm.
that is? And like sort of what's your understanding of like how that came to be, and what's the role of group peer support?
I mean, one-on-one is great. If you just want to work with one person, just kind of work on like maybe some core issues or some things you're going through, and like you just want to work through some things. But on a group level, it's also very important because you're getting multiple different points of view. You're getting multiple people maybe giving advice, or multiple people sharing something similar to what you're going through. And like I said, that on that connection level of people knowing what you're going through or feeling something similar, there's nothing it's kind of an empowering feeling to know, like, okay, I'm not alone. It's a secure feeling to know other people are going through it. Maybe your peer doesn't have all the answers, because we don't. We're people just like everyone else. So maybe in that group setting, there is someone that could better suit what you're going through, or does have something more similar. So to allow everyone, in the group to kind of come together, in a sense, is really powerful. It's really important. And I think that, uh, yeah, it's really progressive for the individuals in the group to be able to do that. I think people also like, you can go to a room like the AA or NA, like we were discussing, and see the same people all the time, right? Maybe you want something new, or you want to talk to different people. On the app setting, you talk to people in different states, which is also kind of exciting to some people, and like meet different people all the time. So it definitely adds some adversity to the group setting when you do it, virtual, the way that, this is set up.
Yeah, and I'm also just thinking about it practically, right? I mean, like, can face to face, you can barely get in touch with one person, like, let alone getting in touch with, right, like all of them at the same time.
Yeah.
Um, because like the other thing I think about is like I think it's easy for people to forget that I think like if you tell someone, right, like, oh, I have so and so problem, people are going to be like, oh, brave of you for sharing, like, go get help. And then it's like I think people sometimes forget, well, it's like I want to get help, but if I say the wrong thing, I could lose my kids, lose my
Yeah.
job, like and I think that the anonymous groups, like a lot of what we're doing, right, it's like it's almost like what's happened on like Reddit and places like that for a long time now, but we're trying to do that in a way that's like a bit more sort of, right, structured and safe. On your end, I guess, do you see certain groups or certain types of people as more likely to engage with sort of a virtual group than other support?
um I don't know about more so than others, because I think it could really benefit anyone. So I
Hmm.
wouldn't really separate anyone in that category. I would touch on something that you said that I really liked on anonymity. And I will say my own personal experience, because that's all that I can really share is my own experience. And I have heard from others as well in sharing this, that sometimes so I'm from Delaware, it's a very small area. And then when you put in, AANA, it's even smaller within that. So maybe you don't want to go somewhere and you'll run into someone that you know, or maybe you don't want to share something because someone is there. And the fact is, people are people, and things, even though it's supposed to be kept secret, may not be. And that has been a problem sometimes. So in this virtual setting, you don't really have that concern. So maybe people who do have that concern, maybe not an age group or a certain demographic, but maybe someone who has had that issue would feel safer in this kind of environment.
Yeah, it feels like you're in a very like sort of tough position, right? Where it's like I want to go to AA meetings because they're anonymous and that helps me share, but the more I go to AA meetings, like the less anonymous I become, right?
Mhm. Yes.
Um, that makes sense because I mean I also think that it's hard to generalize, and we're just learning a lot in terms of as we go into different places, right? Like what are the needs of the populations we're working with. Like in Delaware is a good example. So Delaware, Wilmington, Delaware, right, is a city that's like 60% African American. And there are studies on disparities out there that if we take an opioids example, there's a JAMA Psych study that found that Black populations were 1/35th, like 1/35, as likely to have a MAT visit, a BUP visit, as a white one. And I just found that so shocking because it's like, there's no way it's just an access to care issue, right? Like when you're seeing, 1/35 type disparity. And it also makes me think about how, like in our own platform, we have many people who use our app who talk about not being concerned for their safety if they were to go to groups because they have a partner who they don't
Mhm.
feel safe with. A lot of single working mothers. So I just think, or yeah, I would wonder your take on like who are the sort of people that you think are who are the people that I guess like hardest to reach in the face-to-face setting that might be more likely to engage virtually because we don't know, but I think it's clear that more people will engage virtually. We just don't exactly know,
Mhm.
right, like how that's going to shake up in like different areas.
I mean, I agree with us just like learning, and I'm
Mm-hmm.
actually pretty curious to see, what those statistics look like too. I know you mentioned one of them being single moms and that being difficult for them to get places. That would be me. So I can see where that would be, definitely something that people could use and access. And it does go back to accessibility and convenience and really just like what works best for the individual. And for whatever reason, they do feel comfortable in one environment than the other. I still think all environment, should be available to them, all environments for their choosing to whatever makes them feel most comfortable, wherever they want to be, whatever just helps them, which is the end goal is just helping them and supporting them. I think is what matters. So I would be curious to see what the statistics look like for that as well.
Definitely. And I think it's so important what you touched on, that we give people choice, right? I mean, like people are right now, most people are getting to AA meetings, you're getting to peers when they're court mandated, right? So
Mm-hmm.
it's like we really need to say like, hey, because people might not always be willing to say like, oh, I have a heroin addiction, but they're always going to be willing to say something like, this feels bad. I'd like to, like be healthy, or I don't like necessarily feeling horrible. And people have every incentive, I think, to take the agency in their own recovery. And the minute we forget that, that's when you get well, for our listeners, I'm sure there's plenty of insure people on the managed care side who have built very, very fabulous care models, right? I'm sure you've built fancy patient-centered medical homes and like all these other wraparound services, but then those programs fall flat on their face because people don't use them. And like
Mm-hmm.
if you're not able to engage people on the front end, I don't think it's kind of all the effort is for moot, right? You can pay for all the
Yeah.
services in the world, but if people don't feel like they have choices and in navigating them, what's the point?
Okay. A question for you. So what is your expectation with the role drift and the peers and this new kind of experience that you're creating? What are your expectations for peers and for everything like that?
Well, that's definitely a big question. I mean, I would say the first thing is our expectation is that we're going to learn, right? Our expectation is that we're doing something new and we're going to, stay to our straight to our core values and learn. And that being said, like our expectation for a peer is the same expectation we have for all of our other employees, which goes to our three core values: authenticity, candor, and ambition. And I think peers, just by nature of the fact that they really are like the heart and soul of our organization, they have a very unique role to play, right, in each of these values. I mean, the first is like authenticity, right? So authenticity for us is basically saying, you can't serve a diverse population without a diverse team. And even if you have that diverse team, there's no point if like they're not able to really speak their mind. And I think that's where peers can be really powerful in terms of not only like sharing their own personal lived experience, but like really advocating for how do we have these conversations in a constructive way. Because right, we're working on these issues that everybody has strong opinions on, and everybody has strong opinions on because they've usually either impacted their lives or the lives of people they care deeply about. So being able to like engage with these issues and making sure people feel safe and feel comfortable voicing them, but then being able to engage with those topics really segues into the next value, which is candor. And for us, candor is fundamentally like it's about accepting criticism. It's about acknowledging that we're putting outcomes first, and we're doing something new, right? We're doing an intervention that's new, and that means we need to measure outcomes, and that means sometimes we'll do things that sound great to us, but we're going to measure it, and maybe they're not as impactful on patients as we thought. And I think the expectation that we have from peers is that we really have peers who are fully bought in, right, to that integration of the medical model, that integration of measuring evidence-based practices, because we see that as that's basically a fundamental step that we're taking to allow peers to have more of a role in the treatment and recovery system. It's what allows peers, right, to coordinate care with other providers. It's what allows us to say, hey, this is why we're confident what we're doing should be considered essentially a treatment program. Not that we don't think, clubhouses and these other more consumer-run organizations are valuable. They've been useful to me in my own personal recovery. But at Marigold, the reason we really need folks who are ready to embrace criticism, to embrace like that integration of the medical model, is we do a lot of learning by doing, and it requires constant iteration, and it's frankly it's something you need to really embrace, because otherwise it can frankly it can be exhausting. The third is ambition, and I think peers oftentimes like they kind of do this on their own anyway, right? Because peers are people who essentially like live like their their recovery, their history, like day to day. So it's a very it's something I think most peers do naturally. But I think like the other piece, it just ties back into this understanding that we can't be satisfied, right? Like we're doing work. It's great to have the impact that we have and to be able to serve the people that we're serving now. But as we said at the start of this conversation, we really should start with the peer support and go that way and not backwards. And
Mhm.
every day we wake up, we need to remember that that's the world we're living in. We're living in the world that we don't like, and we need to move it right more in that direction of putting the individual first. So while that does require, I'd say it requires a certain it definitely requires a sort of willingness to engage, and a sort of energy that isn't, I'd say, common in a lot of other settings. But for folks that do come here, I think they find it very rewarding because you learn very quickly, and you have opportunities, right, to grow in all sorts of different ways. Julie, what advice would you give to other organizations, not just us, because right, lots of people trying to hire peers right now. That's something we found, right? We find a great peer candidate, we talk to them, and it turns out they, interviewing a bunch of places, but not all these peers tend to stick around at these roles for a long time. And why do you think that is?
I think so. Everywhere kind of has like their own rules on hiring peers, and one of them being their clean time, or whatever is based on their recovery time. And that can vary. And I think that it's really important that there should be a substantial amount of time. I know it's very controversial thing to say, because who can say, in someone's journey, how far they are. But I think it's important to have someone who's solid, who has been doing it for a while, has a good amount of experience, not just in the lived experience, but also in their own journey and their own recovery, and has been through enough things in this part of their life that they are able to kind of handle it themselves and then help others handle it. So I think having like that solid background, also, I volunteered before I did this. So I think that's really good, is to have like an idea on like what you're doing. I've unfortunately seen people with, you know, great hearts and passion and like wanting to help people. I've seen them unfortunately fail because they want to help, but they put themselves in a situation. It's very tricky what peers do. You're kind of putting yourself back in the lion's den, in a say. You're putting yourself back in a situation that you left, and that may be a trigger for you, and not everyone can handle it. So just be like, um find someone that's really sure that they can do it, that has a lot of experience in their own recovery, and their own stability, to be able to help others find stability in their own journey is really important.
Yeah, no, that's well said. I mean, it almost makes a point that if you're a big health system and you're looking to hire one or two peers in your emergency department, and you're looking, honestly, you might not have the infrastructure to properly, right, like find and support that one person if they're just going to be a couple peers amongst your larger team. But what you could do as a health system is nurture that culture of volunteering, for example,
Mhm.
because you do that right, and in a couple of years, you're going to have a dozen or so peers, right, like pop up in your immediate area. And I think orgs could also do well to sort of internalize what you're saying by thinking a bit more long term and realizing, right, that like,
Mhm.
well, these are patients today, yes, but like, right, like at some point, right, like if you want peers, right, like they're gonna have to, right, kind of go through that process. And then, do you have thoughts, I guess, on how should peers be involved in decision making, in these organizations? I mean, we certainly have some processes here we can go into, but what's sort of your overall opinion? Where does it go right, and where does it sort of break down?
I think especially like a company similar to this one, where like peers are the focus and peer support is the focus. I think we should listen to the peers, considering like they've been through it. And in a sense of listening to the peer, you're actually listening to the patients, because you're trying to hear what the patient's thoughts would be. And I think you can hear that through the peers' words, because it's almost like they've gone through it, and then they've come to a clear sense where they can process it, and then in return kind of verbalize it back to you. So I think peers are that in between, the patient and then the medical, and there's a peer that can kind of talk for both. You know what I mean? So I think just like listening to the peer, because the peer was once the patient. And so I think that's going to be opening the door for you to be able to understand, what the people that you're working with need, and what you need to do to get there.
Yeah, and it's almost like it's a very sort of it's like a two-way street, right? Where it's on one hand the peer says, "Hey, I've got this lived experience, but by stepping into this role as a peer, I'm admitting or I'm acknowledging that I'm using my lived experience as an intervention." So that means like I'm okay with
Hmm.
somebody telling me if I've had enough clean time, right? Because like normally you'd never tell someone, "No, your recovery's not good enough." But when you're in a peer
Yeah.
setting, it would not be responsible, right, to not say, "Hey, like is this person able or ready, right, to support patients?" On the other hand, healthcare organizations using peers would really do well to recognize that even with one or two full-time peers, they're really getting a gateway right into the patient experience. And it's not really like they just have one or two of any other provider or staff type. They really
Hmm.
are, making a fundamentally different investment. Would you say that's right? Or how would you, color that or add character to that?
I would agree with that. And I would also say in the controversial statement about, telling someone they don't have enough, recovery time or clean time, in a sense, if you really want to like change that perspective, you're really protecting the person from getting into something that they may not be ready for. In order to do this work that any of us do, whether it's you or me, whether you're front and center with the patients or behind the scenes, you have to really take care of yourself. People who don't take care of themselves can't help take care of other people. So I really think that it just goes into that. And then, closing that gap between the medical and the patient, and getting everyone to kind of, on one accord, and to understand each other, the fluid like communication between everyone.
Yeah, that's really well said. We are out of time today, but I've enjoyed taking the time for this conversation, especially because it's a little bit nice to talk about right the vision and the work instead of right our regular day-to-day meetings, which I think are
Yeah.
a little bit less polished, perhaps. I think I can end by saying that if you're interested in our work, you can always go to our website www.marigoldhealth.com. And if you are a patient in Delaware, Massachusetts, and you're interested in working with a peer, Julie, what's the number patients can call to start an intake?
So the number is the area code be 617 and then 390 8653.
There you have it. So yeah, thanks everyone for your time, and we're happy to answer any other questions through the conference, or if you just want to reach out directly through our site. Have a good one.
Bye.